Good morning and welcome to those who are joining. We will be starting in a minute or so. We'll just let people arrive, find the comfy seats, get their cup of tea ready, a couple of biscuits to dunk, and then we'll begin. Just be 30 seconds away or so. Welcome back to those who were here in the first session this morning. And a warm welcome to those in whom this is their first session. Okay, hopefully you can now see me. I'm not sure whether you can or not. So I'm Matt Sawyer. I'm a GP by background and helping with the Carbon Literacy Project today. This session is going to be where we get to hear about some of the experiences from those who have either delivered the training, the carbon literacy training for healthcare, or who have received the training. This is very much going to be a conversation rather than anything else. So please ask any questions as you would like in either the chat or in the Q&A boxes. So just for those who weren't here previously, I'm a GP, but I also deliver carbon literacy training both to primary care and secondary care. It has been really, for me, a fantastic journey over the last year or two, partly because I've got to meet so many different people in so many different organisations, but also the feedback that I've received from people who have undertaken the course has been fantastic. And just from a couple of quotes, we'll see whether our participants agree with these in a moment. So one has said that they've thoroughly enjoyed the course, learnt a lot in a relatively short period of time, and feel that they can take that knowledge further to committing genuine action. Somebody else, this has given me a new drive to do more to reduce their footprint. Somebody else, this has made an instant change to the way that I approach day-to-day activities when considering their wider footprint, and really enjoyed the workshop. I do feel it has made a difference to my approach already. So absolutely important that we see some of the outcomes of the training. So I would like to start by asking our distinguished panel guests to introduce themselves, and when they've done that, I will start to put some questions to them. This is not a grilling, this is not Prime Minister's question time or anything else. So if I could maybe start with Stella, would you like to introduce yourself and tell us a little bit about where you are and where you're from?
Hi Matthew, hi everybody. So I'm from the East of England region. I'm working in the Greener NHS team in the region, and I'm Net Zero Sustainability Engagement Lead. And we had the privilege of receiving the training from Matt, and are in the process of testing that and piloting it and rolling it out. So really pleased to be here. Thanks, Matt.
Fantastic. And if I could ask Pete to introduce himself as well, that would be fantastic.
Yeah, thank you, Matt. Yeah, hi, Pete Waddingham, Programme Manager with the Yorkshire and Humber AHSN Academic Health Sites Network. I've been here for 3 years, and before that I worked in the NHS for about 10 years in a commissioning role. I've undertaken the training. I'm looking to continue that journey and look to see if I can help my organisation become carbon literate, or the members of staff that work within that organisations, because I think it's a very important part of it, which hopefully we can give you a flavour of today. So thank you, Matt, and pleasure to be part of this.
Fantastic, great to see you both. We're also we'll have a colleague called Mark Richmond join us shortly, and I don't think he's in the room at the moment, and as soon as he does, I'll ask him to introduce himself, and we will hear about his experiences as well. Before I do that, I do apologise. Mark Richmond has just joined us. Hopefully you can hear us, Mark. Fantastic. Good morning. We just had our fellow panelists introduce themselves, and I said that you would be along here shortly, and as if by magic, it's like a Mr. Ben moment. He appears. So if you'd like to introduce yourself and a little bit of background, then we will start talking about the toolkit and the delivery.
Indeed, thank you, Matthew, and apologies just for some slight technical issues joining the session there. I couldn't quite get in just 5 minutes ahead. So good morning, everybody. Mark Richmond. I work for a company called WRM, and we provide a range of sustainability services to healthcare organisations. And we also do a lot of work with Leeds Teaching Hospitals, where we work alongside the sustainability manager, again, to deliver number of interventions, including carbon literacy training. So I'll keep it brief at that, Matthew.
No, that is absolutely wonderful. So we've got three fantastic people, and so I was going to start with the first question of what have been your experiences with the toolkit so far in for you and for your organisation. I was just going to start with Stella only because I introduced her first. So Stella, how has it been for you?
Been very good, Matt. We had 4 of us from the East of England network that piloted the session with yourself. So we were trained, 4 of us. And then what we were really interested in doing is thinking about specific audiences in our region, so procurement specifically. So we then cascaded that training to a handful of procurement related staff to see whether we had understood the training we were given, because that's always an interesting bit, isn't it? Once you start to try and share, you realise that you perhaps weren't paying attention to some of the sessions, Matt, and we weren't quite as versed as yourself. But we were very interested in looking at how we might support carbon literacy in terms of developing that procurement specific kind of module or kind of engagement, making sure that it was relevant and we kind of included the right sort of context for our procurement colleagues to make sure that they felt it was something that they could cascade out and that they could connect to. And so our experience of that, I think, without going into too much detail, it was a really positive one, both in terms of solidifying our understanding, our learning as part of cascading, but it's the discussion and the conversation piece that then started almost like as a kind of catalyst that has been the most useful part of that. And we're just in the process of the 4 of us that had the initial training. We're just running another session, which is a kind of more generic, where we're just sharing that again with what I'd call a safe audience, trusted colleagues that we know well, to just try and again support our understanding and refine our delivery of that training. And I think that's probably my overwhelming feedback, Matt, that I don't know how you did it actually, because to do 8 hours kind of delivery, even if it's in a couple of hour chunks, it's quite, to keep that energy and keep yourself kind of focused and facilitate conversations is quite a skill. So for me, the takeaway is practice it in a safe and manageable environment without putting yourself under too much kind of pressure as part of that cascade. And each time we deliver it, we learn a bit more. We perhaps refine a little bit about how we're pitching that, or how much time we leave for certain sections to allow, good conversation and not feel that we're rattling people through, and that it's a very two-way experience. So
I think I would, that is wonderful. I think that one of the points about having very specific content to that department is absolutely key. So absolutely, the science of the climate crisis doesn't change regardless of whether you're in catering or transport or anything else. The impacts on your hospital or your service delivery doesn't change. If it's going to flood, it's going to flood. But actually having it so that the procurement department understands what it means to procurement. That for me is one of the beauties of the carbon literacy healthcare training toolkit, that actually you get 6 modules that are the same, but you then can adapt 1 or 2 of them depending on the department. And absolutely, I think that refine and practice and evolve and tweak and improve. I don't think that this is a static thing either. I think it's very much that you will learn something from the group that you've delivered to. Pete or Mark, would you like to add some comments? How have you found from it? I think that Pete, you have done it from a learner's point of view, and Mark, I think you've done it from a trainer's point of view. So maybe if I hear from Pete as a learner next, and then from Mark as a deliverer.
Yeah, absolutely. Yeah, we'll do. Yeah. So just to give some context, the organisation that I work for those that don't know, we're seen as the innovation arm of the NHS. So we try and find lots of innovation. A lot of that is of a digital nature. So I was doing a lot of work around trying to quantify the impact that some of our innovations might be having. So, for example, keeping people out of hospital by using a digital platform. What could that do from a carbon saving perspective? And then obviously I was horizon scanning other pieces of work and what was out there, and stumbled across, I think, carbon literacy. I mean, Matt knows that I like my social media. I think it's fundamental to topics like this that we really connect and share learning. And so I'd seen the carbon literacy, the training program, and thought, no, this is good. This is what I want to go on, because I'd already started doing some sort of self-discovery and trying to look at the resources. But what I'm really keen on is that we do need to start understanding impact, the scale of it, and doing that quantification or becoming carbon literate and understanding the scale of the problem from a health perspective and being consistent across health really gets everyone on the same page. And I think you can't underestimate that. So my experience of being a learner on the program, really liked it. Some of the resources that Matt shared, I even watched at my own leisure again on YouTube on the night in the following weeks. I've even shared them with friends and family because, they're really quite powerful and punchy. Certainly when watching videos about tipping point, it's quite a strong phrase, is tipping point, and we're really at that sort of ecological fine balance, really. So, I think some great resources that I was able to be shown, and that's fantastic. So I really like it, and what I like about the project as well, and keen to hear from Mark and Stella, is how we take it to the next level, so that I've sort of dipped my toe in the water here as a learner, but then how do I become a bit more competent that I can share that knowledge with other colleagues, and as I said, then get some consistency, which I think is really, really important, because there's a lot of people, if I look at Twitter and things like COP26, it's those that are really passionate about it, but how do we get everyone on that same level? And Matt, I think you threw the statistic into me the other week, didn't you, about, was it like 1.3 million health staff across the board? How do we get everyone to be carbon literate? So that's what interests me, and I like this project. I like the resources. I like the structure of it. So yeah, there's my experience so far.
That's fantastic. And absolutely. I mean, I think that knowing that there's a lot of resources out there, but it's trying to find the ones sometimes which are most impactful without having to watch, 57 hours of YouTube just to find that 5-minute resource that you think that nails it. That's exactly what I need to be able to explain why I'm talking about carbon literacy, or why we're talking about the climate, or why. And so I think that that's one of the advantages as well, that we then can start speaking about the same sort of carbon language because we've got the same sorts of resources. Mark, as a trainer, because I think that you've so I as a clinician tend to train clinicians. I think you tend to work your way up the food chain depending on where you put clinicians in the food chain.
Yeah. So we've been doing a number of work streams with lead teaching hospitals, training different groups of colleagues, and one of the first focuses has been in education, estates and facilities, and educating colleagues across the estates and facilities department. And I think we're just over 100 colleagues now that are carbon literate in that team. Just picking up on one of the things Peter said there about how do we cascade this out more and get more people involved. One of the things that we've been doing there is using the kind of core training team to go in and then support others to deliver the training in future sessions. So getting other colleagues up to speed with and understanding carbon literate themselves, and then being able to go off and deliver that training to new groups of colleagues. In terms of the previous question there on a kind of a general experience of the toolkit, one of the things that we found in those estates and facilities sessions has been that colleagues can come together away from the focus of the day job to really reflect on how things are done. So, if it's estates colleagues that are maybe involved in things like building management systems, BMS, other aspects of energy consumption around the estate, rather than being focused in on the discussions around pressing issues that might need rectification or resolution. The carbon literacy training provides that opportunity to think about, particularly in some of the breakout sessions where there's the options of discussion, opportunity to discuss their roles and some of the things that they can do at the trust to improve. Another work stream that we did was just last week on Monday was leadership training. So we used the leadership toolkit and we worked with board leads from 8 organisations across the Yorkshire and Humber area. And I think that was really important because it allowed peer-to-peer learning, and it allowed the various organisations to look at what each other are doing at a kind of board lead and a commitment lead, and again to share knowledge and understanding in a forum that might not normally focus on that kind of topic. So yeah, a couple of sessions. We're also now moving on in LTH to develop training for the theatres colleagues as well. So again, another focus of that training.
That is fantastic. And am I right in thinking, Mark, that Leeds Training Hospitals become the first carbon literate NHS organisation?
That's right, yes. Yeah.
So as I think that I would probably go a lot bigger of yes, it is, because I think that is a huge step. I mean, just imagine if this is the first domino of all of the acute trusts or foundation trusts or ICSs, that suddenly we've got carbon literate organisations up and down the country. So for me, that is actually a much bigger step than in terms of trying to get it out to other people.
Yeah, it is. And at the moment it's very much focused on the estates and facilities team, but I think the work that we're currently doing with the theatres team and moving into the clinical side, that will enable it to grow much more rapidly across the organisation and much more comprehensively across the organisation. But yes, so that work in the estates and facilities has got the initial carbon literacy status for a large trust like that, which is no simple feat.
Absolutely, and I think that that is a very important and significant badge to then wear. I think the other thing that you mentioned there was about that peer-to-peer delivery. So as a clinician, I can speak to other clinicians in the same language. We can talk about inhaler techniques and the greenhouse gases, the fluorinated gases that are in the propellants of inhalers, for example. I'm not an estates manager, so actually for me to go and try and talk to estates managers is much more difficult. And one of the things that I particularly have enjoyed from the carbon literacy training is that delivery from a respected person from within that team, and that to me I think has been crucial. So actually being able to sort of cascade that training so that you've got other trainers at other departments and on other wards be that respected person who knows what the material is, and to then deliver that to their work colleagues has been a real boom from this as well.
Yeah, I'd suggest it works the other way as well. So, I think the great thing about the structure of the training, particularly the breakout sessions through the day, is where other colleagues from areas that I've not got a depth of experience of coming in and contributing their own thoughts and suggestions to whatever the task or the group activity is there. Which again enables that more widespread knowledge sharing and learning, which is really what it's all about.
We certainly are very interconnected in terms of hospital departments or healthcare sector. We can't have a green operating theatre if we don't have buildings, if we don't have energy, if we don't have procurement. We need to have all of these things because each of them got a different role to play. So if I ask sort of Stella and Mark this one, in terms of the preparation for delivery, what sort of things would other deliverers, what sort of things might they need to consider in terms of preparing for running a training course?
Well, I'm not sure, Matt, whether we properly prepared the first time around. I have to say, we the 4 of us that were cascading the training have kind of been operating in the sustainability environment for some time. So we did kind of have a couple of sessions where we sort of ran through the materials and work out who's going to say what and rehearse that somewhat. I'm guessing, though, all of us would probably say the same, that we could probably have done that better. We could have been more effective, because what we didn't pre-plan for was how will this be received by the audience we're delivering it to, and what might be the questions that they come back at us with. So the session we did with you, Matt, I think all of us, we were quite keen, quite eager, and we asked lots of questions, and your general broader knowledge enabled you to kind of bat away and steer us and guide us in that. That's probably where we fell down. So we had kind of caveated the session with, we're not necessarily experts in all of this that we're about to share, but actually we probably should have done more around, because many of those were coming at it new, what will be the things that they will ask us. And some of that was about the technical, and some of it was in the policy arena, in the context that we were kind of delivering this session. And I think I might have mentioned earlier, with the first session we did was around procurement specifically, and our knowledge about what was happening in the procurement world and how that kind of could cross-relate to climate change. So different things that are happening there around social impact and changing some of the procurement regulations. We perhaps weren't able to do the read across as neatly as we perhaps would have liked. But, you know, as they say, every day is a school day, and we learnt a lot. And I think because it was an audience where we knew them well, and we were quite upfront about, we hope you're going to come away with something, we're going to come away with something, and we hope we'll be able to develop a better session so that we can then cascade that with your team. So I think it's really about the preparing how people will react. And there's a lot of emotion in that course. And you get, some people get quite downhearted. There's periods of it where trying to keep it quite upbeat and keep people engaged can be a challenge. And I think we hadn't quite prepped for some of that either, as well as we could have.
Do you think that, so I think, yes, absolutely. Emotion, I think, is one, and particularly sort of, I think the first third, the first quarter, where it can feel quite negative, that you sort of end up in a bit of a hollow before you start sort of, you know, reaching the promised land, as it were. So, but the other two things, one is about recognizing where the audience are on the journey. And of course, if you're delivering to 12 people, you're going to have 12 people potentially at different stages of their ecological journey, or their carbon journey. And the second is whether having a mixed delivery team, so that there is somebody from procurement to answer the procurement questions and somebody from estates to answer the estates questions. And so whether a mixed delivery team, if it's a mixed audience, would work well.
I think it would. I mean, we had the four of us, which I think gave us some room to maneuver when people asked a question. If you were presenting, you've got other people that have got the space to think. I think it's quite helpful to have somebody who's championing that session. So we kind of had a sponsor for the session that we're talking about procurement, and I've got another one actually tomorrow where we're cascading it to one of our ICSs as a sort of pilot. But I think it's the context, so that bit about why not everybody comes to that training knowing what they're about to experience, or why, or what's going to be expected after. And some of their questions are, where does this fit with other stuff that's going on in my daily work? And where does this fit with some of the other policy drives that are coming from other aspects of their business? And so I think my tip to people would be, allow more time at that beginning to kind of do some of that context piece, because until people kind of quite understood where it sat, we felt we were going over some of those questions as we went through the session, and we probably could have just done with almost like a half an hour session on its own, just to do a bit of intro before. It depends how well you know the audience, and, you know, I think that's part of the challenge, really. I think if people know what they're coming for, you can start the delivery, and it's relatively straightforward, Matt. But it was how does this impact on me? What am I meant to be doing with it? You know, what's this journey? And having somebody to set that context that's known to that group, to that delivery group, I think is quite helpful.
Do you mind if I just come in on that, Stella?
Please do.
Thank you. Yeah, I think it's really good shared learning, and I know you've just reached out to me to connect, Stella, so thank you for that, and I will take you up on that offer, because this is the kind of thing we do need to understand. And what you just described there at the end, that's not unusual. You can imagine that people people are thinking, well, wait a minute, you're telling me that COVID's pressure, you know, or cardiovascular disease is pressure, or the cancer waiting list of pressure. You know, there's lots of, like you say, the policy kind of pressures and just the strains anyway. I mean, the NHS was always a strained entity just because of the nature of what it does. So I think you're right, you know, allowing people just to get that off the chest right at the beginning is probably a good shout, really. I can see why that would make sense. Because I think if you leave it to the end, it'll just build up. And if you don't let people sort of get it out first, it might hinder, or it just doesn't give you the full sort of context. So thank you for sharing that, Len. Very helpful.
What about yourself, Mark? How have you found the delivery because I think you've probably delivered quite a lot at Leeds. How have you found it?
Yeah, so in terms of preparing for sessions, you know, scoping the sessions and thinking about the respective roles of the colleagues that are going to be attending, and you know what those colleagues can do. You almost have to kind of think about what the action plans might look like and what the type of actions might look like, so that you can then prepare the session so it kind of builds up to that anticipated outcome. And you know, for the leadership session that we ran with the board leads, that was very much around kind of targets and commitments and kind of board level responsibility. A lot about communication in there as well, out to colleagues. Whereas it was perhaps more tactical on the kind of tactical level of interventions on things like estates and facilities. Yeah, and I think, you know, a point Stella made there was around, you know, the kind of the realization and the kind of balance of that first module, and you know, the kind of shock that has, and then and the realization of the challenge, and then following that up with positivity. So you know, I think getting some good local examples in there as well is important. And for the leadership one, we had some images of flooding in a town called Otley. The hospital is on one side of this bridge. The bridge is closed because of flooding. It's inundated, and you know, the hospital is effectively cut off from a large part of the population that it serves. You know, showing that as a kind of local impact and actually relating that, you know, to healthcare priorities. That is it's almost a stranded asset in that instance, because it's not functioning, it's not able to be accessed by a large part of the population that depend on it. And I think, you know, getting those real examples at a local level that show, not just on a local level, but an organisation specific level, that show how climate change is impacting and is causing disruption now, not in 20 years time, not in 30 years time when the targets are in place. That's a really important part of preparing for the session. And another thing that Stella said there was about, you know, trying to show to the learners exactly where sustainability fits within their role. You know, we have this mantra that sustainability interventions, they're at one with cost savings, which are perpetual pressure on NHS organisations. And also sustainability is at one with care quality. As said before, you know, the example we put in there of Otley Hospital being cut off, there was a great example of sustainability, climate resilience and care quality all being aligned. So yeah, thinking about the outcomes, thinking about local impacts, and thinking about tailoring it to individuals' roles.
That, I think, is fantastic. One of the things that I've always enjoyed about the Carbon Literacy project is that they definitely move away from the polar bears. I live in Yorkshire. We don't have any polar bears here, but we do have the impact of flooding. You look at Hull, Leeds, Sheffield. We all get impacted. We look at, you know, the heat waves and how it affects moorland fires, for example, and air quality. So actually, one of the beauties that I like about the slide set that the Carbon Literacy project have is that there are specific slides in there that are tailor-made, or that are tailorable and customizable to your organisation and to your location. So this is about, you know, the staff who are trying to get to work, or it's about their families, it's about your family, it's about your patients. And to me, that really brings home the message to it's us and it's here and it's now. It's not in 2050 and somewhere overseas. And I think that is really, for me, one of the really important messages. So I'm doing a presentation on Thursday this week, and it is going to have, this is what it means to you in your area now, or, this year. So in terms of the, sorry, Pete, did you want to come in at that point? Nope. So in terms of the impacts, either on yourselves or on the organisations that you either delivered to, so for me, the carbon literacy, it's very much about the actions that are taken, the impacts that it's had. We don't just want people to learn for the sake of learning. It's what positivity, what actions, what impacts are going to come out the other end. So I guess so for me, the question is probably, what have been the impacts for you as an individual, for your organisation, or for the people who you've delivered to? And shall I pick on Stella again? I'm afraid that you went first. So I'm going to keep picking on you.
Yeah, no, that's fine, Matt. I mean, I guess so my sort of previous background before I came to the NHS was really in sort of education and skills development and economic development. And I guess I was drawn to this project because I've always had a very strong kind of pull towards that kind of people aspect, and that sense of how are we going to make the NHS net zero if we haven't got that kind of carbon literacy. It seems a bit foolhardy. But for me, the impact of delivering this kind of says, actually, there's a lot of people that would say, well, we know a bit about climate change, but actually it's not intuitive. That carbon literacy level is really low, and I count myself in that. And I've been kind of working on the project for a couple of years, in the sense of what I think is really difficult is if you ask somebody to just think about a day in their life and to actually articulate where the carbon is and why it's there and what you need to do to get rid of it, that would seem to me to be something we all ought to be able to do, but it isn't actually that straightforward. So I think it kind of reinforced delivering this training for me, the importance of making sure we cascade it far and wide, and we might need to tailor that for different audiences, but everybody really needs to be carbon literate. But we also probably need some follow-on tools to support people's action planning that says, so how can we facilitate and enable you to now to take that forward and be more aware, rather than just doing a piece of training that you might think, yeah, that's great, I've got that, but then the pressures of the day job take people away. So there's a bit for me about making sure that action planning comes to fruition. How do we support that part of the process and connect people after the training, as well as giving them some core information that would help them to take those steps, if that makes sense.
Absolutely. Pete, would you have any comments?
Mine's probably a little bit too early yet in terms of the carbon literacy training, but I think just to kind of reiterate my desire to connect with people and that shared learning on this topic and the constant talking about this topic, which is what I've been doing for the last sort of year and a half, 2 in this role, has allowed me to connect with lots of people. And on the back of those connections, we've gone off and done a couple of pieces of work. So, for example, we supported the Centre for Sustainable Healthcare on the Green Surgery Challenge. Leeds actually just won last week. It was Leeds Surgical Community was one of the 4 teams, and they were successful with the work that they'd done to green their surgery. And that comes on the back of the relationships that we're creating and the fact that we're having this conversation and networking with people. And then also I've been supporting Leeds with a staff engagement platform, which I'm not going to say too much about because it's not my news to share, and I can't remember if they've announced it yet. But there's some exciting work that is behind the background. And again, that comes on a direct result of me being on calls like this, networking with people and getting people interested in this topic, and then just connecting outside and looking for what the opportunities are. And I think I'm looking for that with the carbon literacy project. I want to get people, I want to be able to sort of deliver training myself. I want to then be able to talk to people, and I want them to make connections with others. And as I said, we're starting to do that work internally in an informal way anyway. So we're looking at things around asthma and inhaler care. So all of this learning that I'm developing now is useful to pass on to others. And so I can only imagine it'll continue if we kind of have this more structured approach.
I suspect there's going to be a conversation between yourself and Stella. So I think Stella's probably that one step further ahead, in the sense that she received the training and now delivers it, and you've received it and you will deliver it. Mark, what about yourself in terms of the impact
Yeah, thanks. I think the one of the big things that we see in the delivery of training is learners realizing how commitments that are made either at a national level or in individual organisation green plans can be delivered. So colleagues will have heard about the net zero 2040, 2045 targets and the intermediary targets. They might have heard through trust newsletters or internal communications that those have been adopted by their organisation. But yeah, going through the action plan and then thinking, oh, actually, this is something that I can do, or hearing other colleagues come forward with their actions, very much a realization of, oh, this is something that I can participate in, and this is how I can communicate to some of those targets that have been set. The delivery of the green plan typically sits within a sustainability team or a smaller team that's coordinating that activity. So for some learners that we've had on the training that might not have had a lot of direct engagement with the sustainability manager or sustainability team, is that opportunity to get involved. And I think the range of interventions as well, and this perhaps is more opportune in training sessions where you've got colleagues from different parts of the organisation. So I said before, like procurement, estates, some clinical staff in there as well, maybe finance, all being brought together. And it's, everyone can see an opportunity in their own area, but might not have the sight of interventions in other parts of the organisation. So I think there's an impact there, which is learning from colleagues about, what can they do. I think another kind of outcome and impact is realizing where some of the challenges, some of the blockers, and some of the difficult issues that need to be resolved lie. So we get the announcement that we're working towards net zero. You get your individual organisation commitment that organisation is working to net zero, and then you start to think about what you can do. And then you start to think about, right, how am I then going to go and deliver my commitment? And you start to find actually that it's not always a resistance-free path, that there are going to be things that will frustrate that journey that you need to overcome. And I'd like to think an impact from this is that understanding that some peripheral things may need to change in order to pave the way and to enable and facilitate some of the interventions that come out of the training and in the action plans.
I think that absolutely. One of the things that I absolutely agree with all three of you is about that sort of spreading of the good news, spreading of what one place is doing well. So absolutely, delighted that Leeds won the Green Ward, the Green Ward Award. But actually, I want 1,000 wards to be entering it. Things like, the nitrous oxide reduction that's been taking place up in Scotland, fantastic. We should have every single hospital doing it. And it's about how can you spread that the great examples of great practice far and wide. And that to me is one of the things that the carbon literacy project can do as well. And there's actually one of the questions in the chat, which I'm just going to refer to, about the audiences and how we have flexibility within some of the modules. And actually within some of the modules, there are examples of great practice. So what's going on great in one estates department or one transport department or one ward actually can feed into that specific part of the toolkit. So if it's about procurement, it's looking at the examples of great practice in procurement across the country. Or if you're in energy management or in estates, it's putting in the great examples of that. Or if it's clinical work, it's putting in the great examples of that. So for me, it's how do we get all of those bits of great work? And so places like the Centre for Sustainable Healthcare have got a repository of examples of people and places who've done some great and amazing things. And so for me, part of this is that how do we get best clinical outcomes for patients, best outcomes from a financial point of view for organisations at the lowest carbon cost, in inverted commas, possible. In terms, go on, Pete.
I was just going to jump in on that and use that green surgery example with Leeds. One of the phrases that I used last week was that, you know, for any scale, any spread and adoption of innovation at scale, I think you always start small but shout loud. And when you look at Leeds, yes, that might just be one trust, but they've gone now through the heartache of quantifying both from an environmental point of view and a financial point of view, the savings that their work has brought. So that's great. So people need to know that and think, right, there's an off-the-shelf way that, you know, you've delivered something that would probably sit well with our director of finance, would sit well with our sustainability lead. But we've got to shout loud about it so people know that Leeds have done that work, and or whoever it might be that's done that work. And I don't think you can underestimate the power of networks. In our area, in Yorkshire and Humber, we've got 3 really good ICSs who have a sustainability networks. That means that I can go to meetings with like 25, 30 plus providers around that table in one meeting and share quite quickly. So, and there's lots of other sustainability networks coming off of that as sub, and because I'm now talking about this, I have the privilege of being invited to them. So I've been invited to the pharmacy one, I'm getting invited to the primary care one, but at scale. And I think that's where we then need to shout loud once we're within those networks.
Absolutely. Mark, I don't, if you wanted to comment, more than welcome to do so, or I will ask you another question. And actually, I'm going to pick on you first, Mark, this time, if that's okay. So in terms of any advice or tips to sort of NHS trusts or healthcare organisations who are looking to deliver this. So in terms of what your learning has been and what your advice would be to those who aren't quite there yet.
Yeah, I think you've got to think about how who are the key individuals that can, you've got to kind of think one step ahead of yourself a little here and think about who are the key individuals that can go forth and make the most impact once we've delivered the training session. So you're almost looking ahead there. And that might be, and that will vary in each individual organisation. So at Leeds, we've taken the approach of starting with the Estates and Facilities Department first, and then moving that out to other parts of the organisation. In other organisations, you might say, well, actually, let's look at colleagues from across the respective departments and bringing those together. It might be a leadership-led module where you run the leadership toolkit first, perhaps with the board, and then let that cascade down into individual departments. So I don't think there's certainly not a single right or wrong way to do this. It's about thinking about not just that first session and that first engagement, but almost what's the strategy for rolling this out through the organisation, and then kind of winding that back and thinking about how's that rollout going to take place. So are you going to have a clinical training lead who goes off and trains all the clinicians, and you can have a non-clinical training lead, or is it actually going to get broken down more than that? So yeah, thinking about implementation and then bringing that back to the first session.
Absolutely. I think that I absolutely agree that, to me, the carbon literacy training is a great bedrock. It's a great foundation, but it is also about, well, what happens in 3 weeks, 3 months, 12 months down the line, and how can we keep up that energy and that momentum of people saying, yep, I feel great about about what I need to do, but actually, how do you keep that momentum going rather than fizzling out? Stella, what about yourself? What in terms of tips that you've learned? I know that you've talked about sort of preparation and audience and rehearsal. Have there been, if you have a trust come to you after today, what would be your top advice for them?
So I think I agree with Mark that there is a little bit about the strategy. So I've come to this project wearing a kind of regional hat, where our aim is to support our ICSs to roll this out, and for that also within our sort of trusts. So I think there's definitely something about keeping some kind of continuum of conversation. So as we kind of get people coming through this training, and then hopefully they will cascade it, we're quite keen to have a model where perhaps those that have delivered it a few times kind of shadow and support that cascade, because I think there's something about how that solidifies your own ability to deliver the session, But I think it also takes away the pressure for people who have perhaps just been on the training and then suddenly find themselves in the kind of teaching seat. But I think you also need a mechanism to bring back the conversations that the training, when you deliver it, sparks. So for me, the bit that I'm focusing on is how are we going to manage to share the resources that we're building up? So as just going through this process a couple of times, we've had lots of different versions of those generic slides that you can adapt, Matt, for different audiences. Kind of how do we keep that bank in a place that people can then just use and are not starting from scratch all the time? But then as they adapt it and tweak it for their specific setting, that resource is then also available for somebody else. So there's a bit for me about how we take the weight of this out of the system and think about how we kind of cascade that, but also support people, because it's not everybody's natural style to find themselves one side of the screen delivering a session, but they might be absolutely the right people to drive forward those actions in their trust or at their ICS. So there's something about, for me, having a strategy about, well, who are going to be those key core people that form part of that kind of delivery network, and how do we connect to those others that are on the ground and make sure we're bringing back the learning. And like I say, the action plan, it's almost being able to revisit that 6 months down the line and say, well, how's that going? What are those barriers that you've come up against? Are there things that we can take back on a regional footprint, or things that we can share with others to support that learning? So it's almost like, I think Pete said, you start the ball rolling and you start quite small, but it could pick up pace quite quick and you could be quite overwhelmed. How do you make sure you've got the resource to support those lights that you switch on, as it were, as people go, yes, I'd like some of that. Yes, I'd like some of that. How do we make sure that that's manageable? So I think, as Mark said, it's about the strategy of that, whether you're sitting in an organisation thinking about it at ICS level, or as I am thinking about it at regional level. How do you keep the momentum without disappointing people and share the resources and the learning? Because it's quite a big, the set of slides is quite large. It's not always that easy to actually share and transfer with people. So what mechanism do we want to use to do that?
Absolutely. I quite agree. I think it's trying to make it as easy as possible, so that one of the barriers isn't, I don't know where to start, or you've just presented 130 slides over 8 hours. Do you want me to now write 120 slides over to prepare? No, I don't. How do you make it as easy as possible so that almost anybody can pick it up and run with it? Mark.
Yeah, I was just going to add another point beyond the strategy as well, something that just came to mind about getting going within an organisation is getting some building the narrative around what we're doing, and building the narrative that this is an important objective and a priority for the organisation. So at Leeds, you had Julian Hartley talking about carbon literacy training in senior leader sessions, telling the organisation that this is a priority. This is something that we are doing, and we're going on this journey together, and really getting that consensus behind. So yeah, just alongside the strategy there, I think there's also a comms piece, to tell staff that this is an important part of our sustainability journey. It's a lot of staff, when they get invited to a carbon literacy session, may not have heard of the standard before. So it's about this being a something that's substantive and that the organisation supports, not one of the many things that might be perceived as peripheral, which sometimes fall into people's inboxes.
Absolutely. I think absolutely. For me, it's about trying to make it relevant to the audience. And sometimes using the word carbon, people go, yeah, I want to know more about that. But for other times it's, do you want to know how to improve patient outcomes? And as clinicians, absolutely. Or do you want to know about how you might save money? And finance directors' eyes just light up. So, but actually all three can be exactly the same bit of information. It's just how it's phrased for that different audience. Stella or Pete?
Yeah, I was just going to come in and add to that. Sorry, Pete, if you were. I think there's also something about how we get a public kind of target setting or ambition around carbon literacy, because I think when you link that back to the strategy, so we've got our trusts and our ICS is writing green plans or refreshing their green plans at the moment. If as an organisation you've got a plan that says every member of staff is going to have been trained by this point. Then you've got something to kind of go out and hang your hook on and, you know, kind of get some momentum. So for me, there's also something about just building that aspiration and ambition. And I think Mark's right. Once you've got that, the right sign up at a senior level that's kind of conveying that message, whether you can get a video clip or, you know, is able to give quotes and things, you can kind of use that to drive forward the engagement. But I think for me, that's where the beginning bit starts, is getting the commitment that says, how are you going to be net zero as a healthcare service if your staff are not carbon literate? How do you actually think that's going to work? If you can get someone to just buy in at that level, and we can get, you know, some targets that are filtering in, then I think that helps to work out what does that rollout plan look like? What pace is that going at? So I think it is about the target setting and like I say, getting that now where we're in the kind of environment with COP26, where we get those kind of commitments made publicly at the right level, because we will probably need some more capacity and resource if we're going to deliver this at speed.
Absolutely. There is one trust that I know of that does carbon literacy, or has a carbon literacy module, not the full certified course, as part of their mandatory training. So every member of staff in the trust has to do it. And that came in a month or two back. And so it is possible. And suddenly you start thinking, well, if that trust has got 5,000 or 10,000 staff, and we've now got 60, 70, 80% of them who have done this in the last 3 months, actually, that's quite big. That's quite powerful. Now, they're not at the level of being certified as carbon literate, but at least they start to know the language and understand it. So we've got a few minutes left. And so one of the things that I was going to say is, what next? How do we roll this out more widely? How do we get that 1.3 million NHS staff? And I'll start with you, Pete, because I like your voice and I haven't heard from you for a few minutes.
It is a difficult one. I think, you know, there's that phrase in innovation of failing fast, and I don't think we do that enough. I'm one of the sort of people that I jump in feet first with stuff, and I think about the strategy later. And there is that other phrase of culture trumps strategy, and I think sometimes we've just not got to be frightened of getting on with it quite quickly, because as someone's put in the chat on what the lanyard that you've got on, you know, the climate crisis is a health crisis, and it's that serious, but the penny hasn't fully dropped just the extent of this. And sometimes when you think about the scale of it, you can become a bit frozen by the scale of the problem. I mean, I've seen reports that said, if you think COVID was bad, you know, wait till this really kicks in. And you know, I think we've got to play to people's emotions, and that's where I think culture will trump strategy. We've got to do a very quick cultural comms, hearts and minds type of approach, getting the really passionate people that can speak about this. I mean, it's a fine balance as well, because when we see passion, we also see extremism, and that doesn't always sit well with people when you think about like Insular UK and things. So there's a real fine balance with that passion. But yeah, I just think, you know, we've got a lot of the building blocks we need for every problem. I often say this to people, in innovation, we've probably got a bit too much innovation at times. You know, we've actually got the solutions we need. That's not the problem. It's getting those innovations in, which is the issue. So I think we've got everything we need. We just need to, as I say, shout loud about the work, make some really good networks. I think the spread and adoption will come with that. And it's brilliant to hear from people like Mark and Stella, you know, that leadership. You do need it at the top at times, don't we? We all need leadership, good leadership. So, but yeah, I think I think it will come. Like you said, the momentum will build quite fast.
Wonderful. Stella and Mark, would you like to? What's next for you? How do we get? How do we roll this out widely?
I think in that rollout, I think Pete's right. We sort of have to go at it as much as we can. I think there's also something for me about creating a vision of what a sustainable healthcare service actually looks like, and that's the piece that we need to communicate. Not even the, I mean, you know, the science behind it, the evidence around the why. All of that is important, but actually, I think the thing that will actually unify people and get people motivated is creating the vision that says, when we've got there, this is what it will look and feel and sound like to work in the NHS. And that visionary piece is the bit that, you know, we're trying to work on, because I think it's easier for people to go over a mountain. And let's face it, it is a mountain. if they know what it looks like on the other side. And painting the picture of what you're coming away from isn't always as easy as a motivator. So I think inevitably, if we're going to get everybody, more than just that kind of, you know, top 10% that will always come on board for a journey, if we're going to bring the laggards with us and we're going to unlock the investment that's going to need to be made and the risk appetite that's going to need to be there in order for people to make the scale of transformational change, we need to have a really powerful vision, and people need to be able to picture, if I came to work tomorrow and my hospital was a greener hospital, and everything we did, from how we spoke to the patients, to how we deliver our services, to how I got here, to where I bought the products that I'm going to use and where they went afterwards, you know, in terms of that waste. And unless we can actually draw that picture of a circular health service, then I think we will find it really difficult. So for me, that's the bit to focus on, is what does the vision look like? And then it's getting the buy-in at the right levels to that vision, because then as soon as people can see where you're going, it's easier for them to say, right, I know what I can do that will support that journey to that place. Whereas at the moment, we're kind of asking people to stop doing certain things, but we've not necessarily really fleshed out what should it look like.
Brilliant. Mark, and if you and then I will summarize, but please, your vision.
Yeah, so you know, we've got to roll this out quickly and as quick as we can. It's really kind of quite clear and obvious. I think in terms of the kind of cultural and strategy piece that Peter mentioned, I think the toolkits provide that great opportunity. You know, there's ready-made materials there which do allow you to jump feet first. And I think that's one of the great things about carbon literacy, not just in this sector, but in other sectors as well, the fact that the materials are there ready to go. In terms of the future, training the trainer is going to be ever more important. And you know, a lot of the training that we deliver as a consultancy, we're offering that, and then we're following that up with the support of, and then we can facilitate at subsequent sessions afterwards, but putting the emphasis on those individuals going forward, you know, and understanding sustainability. Sustainability is a societal challenge. It requires a societal response. And we need to get carbon literate individuals to realise that they can go and do the training themselves. This is not something that is reliant on the sustainability department or, you know, an environmental or sustainable consultant to come in and do for us. This is the societal, you know, response. And Stella, you picked up about, you know, staff there, and you know, I'd like to think that yeah, this can be a way. This can be another aspect of attracting individuals into the NHS from the recruitment pool. Something that I looked at a couple of years ago was those that are entering the workplace for the first time. They're looking at the sustainability credentials of their employers, and that's actually a material decision now in where they go to work. And I think, you know, we must tap into that at many levels, but I think we must also tap into that in getting more and more people through behavioural training sessions on sustainability, such as carbon literacy.
That is absolutely brilliant. And I will summarise, and I hope we don't get cut off at 1:30 exactly. But if we do, I'd like to say thank you very much to our panellists. But I would also just like to say that for me, I think Stella is absolutely right. Well, I think we all are. We need to build that dream. So Martin Luther King said, I have a dream. He did not say, I have a nightmare. It was all about that aspirational piece of where could we achieve? How could we get environmental or social justice? And so I absolutely think that we need to paint that I had a dream picture for our trust or our organisations. So to close, I would like to say thank you very much to all of our speakers. Coming up next at 1:30 is a session to hear from the Carbon Literacy Project's Director of Advocacy, Phil Corbell, talked to our guest speakers about the importance of carbon literacy in the ambulance services and how carbon literacy can help bridge the gap between NHS policy and staff behaviour change. So I'd like to say thank you all very much. Was it 1 o'clock, not 1:30? Will?
1 o'clock.
I do apologise. You've only got half an hour to have your sandwich and refresh. And we'll see you back here at 1 o'clock. Thank you very much for being here, and we'll see you again soon.